Fourth case, we have this and then one more. Fourth case is a 74-year-old female with underlying lung disease. She had COPD and she had multi-drug resistant organisms that she was colonized with. So not a good situation to start out with. She was in the hospital again for another pneumonia. The respiratory culture for her pneumonia grew out 2,000 colonies of MRSA and then 15 of Acinetobacter resistant to cefepime and carbapenems. T2 identified Acinetobacter in the blood. And again, this was a sample drawn 5 years ago that we tested recently. Blood culture was negative. Because she had known colonization with all these multi-drug resistant organisms, the team did not treat it, and ID was consulted to recommend also not treating because that would probably cause her to acquire organisms that had other resistance patterns. So she wasn't treated. A few days later, unfortunately, she developed an Acinetobacter bacteremia and passed away. T2's identification of this Acinetobacter in the blood could have been telling of the fact that this was more than colonization, and this was in fact an organism that needed to be treated. It was not contained in the lung. It wasn't just another episode of colonization.